Okay, so now we will be looking at types of anemias. So first of all, the most common type of anemia is iron deficiency anemia. It is most common type of anemia and most common nutritional disorder in the worldwide is iron deficiency anemia. Dietary iron is absorbed in the duodenum and oxidized iron must be reduced to ferrous 2 for reabsorption in duodenum. Iron from plants is a non-heme oxidized ferric form and iron from meat is in heme is reduced ferrous 2 form. So what happens, iron is reabsorbed from the duodenum and ascorbic acid vitamin C reduces oxidized iron and therefore important in iron reabsorption. So means vitamin C is also helpful for iron deficiency anemia. Causes of iron deficiency anemia are dietary lack, especially in children and elderly, increased utilization, pregnancy and lactation in children, impaired absorption. Now, celiac disease has absence of villous surface of the duodenum. In gastrectomy, there is absence of gastric acid, which helps in iron reabsorption. And in blood loss, there is GI blood loss. Most common and important cause of iron deficiency anemia is GI blood loss. And in women, there that is post-menopausal women, iron deficiency anemia occurs. Menorrhagia or heavy menstrual bleeding causes iron deficiency anemia, and colorectal cancer can also create this condition. Clinical features of iron deficiency anemia are koilonychia, means spoon-shaped nails, angular cheiliosis, atopic glossitis, pica, consumption of non-nutritious substance. Plummer-Wilson syndrome is also known as triad of iron deficiency anemia, esophageal web, atrophic glossitis, and increased risk of squamous-columnar esophageal carcinoma. So these are the triad of iron deficiency anemia. Lab findings are complete blood count, microcytic anemia has MCV less than 80, and in thrombocytosis there is increase in platelet count. Iron deficient iron profile shows decreased serum iron, increased total iron binding capacity, decreased ferritin, and decreased transferrin saturation. Soluble transferrin receptor is also increased. Treatment will be ferrous sulfate should be given, ferrous gluconate, and responsive therapy of hemoglobin should rise by 1 gram in every 7 to 10 days and increase in reticulocyte count within 7 days. So in this way, iron deficiency in anemia can be treated. Another anemia is thalassemia. It is also a microcytic anemia. Beta thalassemia is autosomal recessive disorder characterized by decreased synthesis of beta globin chain, and it is present common in black and Greek Italian people, and beta chains are in two numbers, and beta thalassemia is classified into two categories: beta thalassemia 0 and beta thalassemia positive. There is mutation. Point mutation is most common cause in beta thalassemia, and types of beta thalassemia are major and beta thalassemia minor. Beta thalassemia major is characterized by microcytic anemia, in which MCV markedly lower than iron deficiency anemia. Iron profile is normal. HB hemoglobin electrophoresis shows decreased hemoglobin A, increased hemoglobin A2, and normal hemoglobin F. Beta thalassemia major is also known as Cooley's anemia. It is mutation of genotypic, and features are severe microcytic anemia, ineffective erythropoiesis, requires blood transfusion, extramedullary hematopoiesis. There, extramedullary hematopoiesis results in skull bossing and crew cut appearance on X-ray, hepatomegaly, hemocydrosis, and multiple blood transfusions will be there. So lab findings will be anisocytosis, poikilocytosis, target cells, reticulocyte count, hemoglobin electrophoresis. Treatment will be folate supplementation, transfusion, and iron. Oral iron chelation should be given, and splenectomy is also important. Allogenic bone marrow transplant is also required for treatment. Another thalassemia is alpha thalassemia. It is autosomal disorder. It occurs in South Asian people and characterized by defect decreased synthesis of alpha globin chain. Alpha thalassemia is due to gene deletion, and silent carriers cause deletion of one alpha gene, asymptomatic and no red cell deformities there. Alpha thalassemia trait shows Asian type and African type. Hemoglobin H is deletion of three alpha genes and characterized by precipitation of the beta chain tetramers. Features are chronic hemolysis, jaundice, gallstone, and skeletal change, increased reticulocyte count index, and severe anemia is there. Hydros fetalis has all four alpha chains present incompatible with life and gamma chain with there. So another type of the anemia is anemia of chronic disease. It is most common anemia in hospitalized patient. In chronic disease, microcytic anemia, this type of disease occurs in which cytokine like interleukin 6 and tumor necrotic factor decrease synthesis of erythropoietin and increase hepcidin is present. So antimicrobial agents are there, and macrophages iron is dosed and reticular endothelial cells below. Causes are alcoholism, malignancy. These are most common cause of uh, the anemia of chronic disease.